Hi, everyone. I'm Amy Freeman-Sanderson. I'm a speech pathologist from Sydney and the current Vice President of the Global Tracheostomy Collaborative. I'm delighted to be joined today by Dr. Vinciya Pandian, the President of the Global Tracheostomy Collaborative.
Thank you, Amy. It's wonderful to be here with you. Tracheostomy Awareness Week is such an important opportunity to pause, reflect, and raise awareness about the experiences of people living with a tracheostomy, as well as their families, caregivers, and healthcare professionals who support them.
Absolutely. And as a part of Tracheostomy Awareness Week, which is the 17th to the 23rd of May 2026, we wanted to take a little time to talk about how we can continue to improve care, safety, communication, and also the outcomes for people living with a tracheostomy. We also wanted this to feel like a casual conversation because tracheostomy care is not just about procedures and equipment. It's really about people, their lives, their voices, their families, and also their goals.
That is so beautifully said. At the heart of tracheostomy care is the person. Every individual has a story, and every tracheostomy journey is so different.
Yeah, that's right. And I've got a couple of questions. For those who may not know, what is a tracheostomy and what does day to day with life for life look like?
A tracheostomy is an opening made in the front of the neck into the windpipe or trachea to help a person breathe. A small tube is placed through that opening. Some people need tracheostomy for a short period of time, often after critical illness, surgery, trauma, or prolonged ventilation. Others may live with a tracheostomy for a longer period or have it permanently because of airway, breathing, neurological, or other medical conditions. Day-to-day life with a tracheostomy can look very different depending on the person. Some people are in the hospital or in the intensive care unit. Others are at home, going to school, working, traveling, spending time with family, or participating in their communities. But living with the tracheostomy often means learning new routines, such as cleaning the tube, managing secretions, keeping emergency supplies nearby, and humidifying the airway, knowing what to do when breathing becomes difficult.
Yes, and from a speech pathology perspective, people are often surprised to learn how much a tracheostomy can affect communication, swallowing, voice, and someone's quality of life. Some people may not be able to speak right away, and while others might be using speaking valves or other ways, so communication boards, writing, technology, or other strategies. So helping people to communicate is really central to dignity, someone's autonomy, and their participation in care as well.
Exactly, Amy. Breathing is essential, but so are communication, comfort, mobility, eating
Mm.
and drinking when safe, emotional well-being, and returning to meaningful life roles. We need to look at all of these aspects of a person who has a tracheostomy.
So, what would you say are some of the biggest challenges people with a tracheostomy and their families face, both in hospital or at home?
In the hospital, one major challenge is safety. Tracheostomy care requires staff to be knowledgeable, confident, and prepared for emergencies. And people with tracheostomy may move from intensive care units to wards to rehabilitation settings and eventually home. And each transition creates a potential risk if communication and planning are not done well.
Mhm.
Another challenge is the emotional aspect. A tracheostomy can feel frightening and overwhelming, especially at first, because most of the times, especially when people are critically ill, they don't go into the hospital anticipating a tracheostomy. They're trying to get care for other illnesses but then
Mm.
along the way, they end up getting the tracheostomy tube. People may worry about breathing, speaking, swallowing, their appearance,
Mm.
independence, what life will look like after discharge. And families and caregivers often carry tremendous responsibility as they learn complex care skills.
Yeah, I think you raise a good point because at home, families suddenly face that they're becoming experts in daily care. So for that, they need to suction, change dressings, recognize signs of distress, manage all the equipment and ordering, and also know when to seek help and who to seek help from. So becoming experts can be empowering, but also I think we need to reflect that it can be exhausting. And some parents and families say it's isolating if they don't have enough support. So whether that's education, resources, or follow-up support.
Yes, we need to really recognize that discharge from the hospital is not the end of care. For many people, that's the beginning of a new phase.
Mm.
So, ongoing education, access to trained professionals, emergency planning, peer support, and clear communication are all very, very critical.
And I think at the very heart of that, acknowledging the person's own experience. People with a tracheostomy may feel vulnerable, frustrated, unheard sometimes, especially when they face communication difficulties. And that's why I think person-centered care really matters so much. So,
Absolutely.
to deliver patient-centered care, who are the different people involved in tracheostomy care, and why is teamwork so important?
Yes, Amy, tracheostomy care is truly interdisciplinary in nature. It may involve nurses, physicians, respiratory therapists, speech language pathologists, physiotherapists, occupational therapists, dietitians, pharmacists, social workers,
Mm.
case managers, educators, home care teams, and there are so many others. Even hospital administrators sometimes make decisions
Mm.
that impact the quality of care of our patients. But most importantly, it includes the person with the tracheostomy and their family and caregivers. And teamwork is also important because no single discipline can address every need. The airway must be safe, but the person also needs that communication support that we've been talking about, the swallowing assessment, mobility, nutrition, emotional support, discharge planning, and long-term follow-up as well.
Yeah, you raised some really important points there. I think we know when teams work in silos, care can become very fragmented. But when teams communicate well, work together, they can anticipate problems, reduce complications, support earlier recovery or engagement in rehabilitation, and really help somebody move towards their goals, having them at the center of those decisions as well.
Very true. And teamwork also helps ensure consistency. For example, everyone should
Mm.
know the emergency plan when the person can be orally intubated. That's when we put a tube through their mouth to help them with their breathing if needed. We need to know what type and size of tube they have, whether they can tolerate the cuff deflation, whether they can use a speaking valve, and
Mm.
what their communication preferences are.
Yeah. And it's really important that those conversations are inclusive of families. In part of those conversations, I think the families really notice subtle changes
Mhm.
first, and they always know the person so well that the clinical team may not know as much.
Absolutely. Yeah, absolutely. Because families and caregivers are not visitors to the hospital or to the care process. They are partners in this journey.
Mm.
So they need to be involved from the beginning so that we can prepare them to be successful once the patients leave the hospital.
Yeah. And so the Global Tracheostomy Collaborative also brings people together. So people with tracheostomies, their families, caregivers, and healthcare teams. So why is that kind of collaboration so important?
Thank you for bringing that up. The Global Tracheostomy Collaborative, or GTC, was created because improving tracheostomy care requires shared learning. Around the world, many hospitals and communities are working hard to improve safety and outcomes, but we can learn so much from one another, and collaboration allows us to identify best practices, share resources, collect meaningful data, support quality improvement, and amplify the voices of people living with a tracheostomy and their families' voices as well. It also helps us to move from isolated local efforts to broader global movement.
And I think that global aspect is so important. And we've certainly spoken about it so many times about those different lenses because we know that tracheostomy care can look different across countries, healthcare settings, and systems. But I mean, what we always come back to as well is that some of these challenges are shared. So, what you highlighted safety, communication, training, discharge planning, access to equipment, and support after leaving the hospital.
Yes, and collaboration helps us to ask better questions. What outcomes matter most to people living with tracheostomies? How do we measure quality of life? How do we reduce preventable harm? How do we prepare families for home care? Or how do we support clinicians with training and confidence?
Mm. And I think that sense of community, it creates such a sense of collaboration and community. People can feel very alone in the journey, whether they're patients, whether they're family members or clinicians also trying to improve care in their setting. So I think the GTC really provides a place where people can connect, learn, and work together.
Mhm.
So if people want to get involved or learn more about the GTC, become involved, how do they connect with the Global Tracheostomy Collaborative?
That's a great question because we would love for people to connect with us. Um, for anyone who's interested in joining this collaborative, you can visit the Global Tracheostomy Collaborative website to learn more about our mission, membership, resources, education, and quality improvement work. And actually, we just redid our website. So it's a brand new website. We would
Mhm.
welcome all of you to go log in, create your own account, and follow us through various activities and events that we are coordinating. Healthcare teams can explore opportunities to join the collaborative, participate in shared learning, and contribute to improving tracheostomy care. And people with tracheostomy, families and caregivers are also essential to this work. So we have a platform where all of you can also join this. And all of these are free. You don't have to pay to become a member of this
Mm.
collaborative. So each of your experiences, insights, and priorities can help guide what is meaningful and help you to understand what person-centered tracheostomy care should look like. So it's really sharing this invitation to everyone who's listening to our conversation in terms of
Mm.
who can join this collaborative.
And I think a great way of staying connected and knowing when initiatives are coming up and how to connect in with people. So, we're talking about Tracheostomy Awareness Week. So I think in particularly the week coming up, we can encourage everyone to take one more step in raising awareness about tracheostomy. So that could be sharing an educational resource in your setting, reviewing your emergency equipment, listening to a person or a family's story, sharing a conversation about a quality improvement project or idea, or connecting with the GTC.
Yes, Amy, every step matters. Awareness leads to understanding, and understanding leads to action, and action leads to safer, more compassionate, and more effective care.
And that is a perfect note to end on, Vinciya. So thanks for joining me today in our conversation. and for your leadership as president of GTC.
Thank you, Amy. It is an honor to serve alongside you and so many dedicated people around the world. And most importantly, thank you to all the individuals living with a tracheostomy, families, caregivers, and healthcare professionals who inspire this work every day.
So thank you everyone who's listening to this, who has shared this, passed it forward. Thank you for raising the awareness of Tracheostomy Awareness Week. We invite you to learn more, share awareness, and join us in improving care and outcomes for people with tracheostomy everywhere.